Greetings. My name is Rohan Kulkarni, and welcome to the Unfiltered Stories by HFS Research. I lead the healthcare and life sciences practice here at HFS, and this afternoon, I have the distinct pleasure of talking to Leah Sparks, who leads Wildflower. Wildflower has been around for about 10 plus years at this point, providing services and technologies to support all aspects of maternity health, coordinating across health plans, care delivery, and families. And Leah has been their leader for all this time, being the founder of the company. Now, as we begin to have this conversation, I want to share a couple of statistics that I picked up in my conversation with Leah from a few weeks ago, which I feel are important for us all to appreciate. One, women are dying due to childbirth in the US at a rate of 3x compared to other developed countries, or that preterm births in the US are more than 50% higher than other OECD countries, and that 2 million women of childbearing age live in maternity deserts here in the US. I think these are dreadful statistics for our country and worth driving some awareness so that we can work collectively towards mitigating it. So Leah, welcome, and thanks for willing to chat with me about the work that you are doing and the work that Wildflower is doing.
Thank you for having me.
Absolutely. So let's jump into it and talk unfiltered, if you would. Let me share some more statistics because to me, some of these are really sobering. You know, maternal mortality rate, or MMR, in the US has increased from 17.4% in 2018 to 23.8% in 2020, according to CDC, which, given the fact that MMR globally has been declining, this really, raised my eyebrows, to say the least. So in the conversation that we've had, the approach you've taken at Wildflower of combining technology and services to increase digital engagement with tools, coaching, has been very positive. So just talk to us a little more about what that approach looks like, and what are the kinds of outcomes you are seeing compared to the national statistic.
Yeah, and I think it's important because a lot of times when we talk about maternal mortality in the United States, we hear this sort of feedback that, well, we're an unhealthier population and et cetera, et cetera. And the reality is the CDC is also well documented that 80% of these deaths are preventable. So clearly there's work to be done and things that we can do in our system to improve this. And so, what we think about the underlying causes of maternal mortality, a lot of it is access to care, not having good access to care. And I think that's part of the reason we saw a spike in 2020 because women weren't getting as much care. And much of it, of course, is related to complications that are either undetected or just untreated or ignored. And so what we've done at Wildflower is put in a set of tools and technologies and services that wrap around the existing providers to really help augment and extend their reach beyond the clinic and the really small amount of time women spend in person having care into the home and into life. And so we do that by way of having devices that can better monitor women. And so even deploying devices like blood pressure cuffs and others that help detect when things like a blood pressure spike are happening can be an early indicator that could help you prevent a complication that could lead to tragic consequences. Having health advocates who are tethered to the patients, who are helping to better understand the things going on in their lives, listening to those signals and helping to interpret them to providers. And so, as I mentioned, while we have been delivering this model for 10 years, and we've had really good indicators that we reduce costs in high-risk pregnancy by up to $40,000 in claims costs. Candidly, Rohan, these are all like early indicators of reducing maternal deaths. While maternal deaths are really high in the US, they're small enough that you need a lot of data to statistically prove that you've moved the needle. And so as we move into a model where we not only deliver technology and services for really targeted populations with payers, to ones where we wrap around the practice and take attribution under value-based contracts for many of those patients as possible, we'll be working to assemble enough data that we can more definitively prove that we're moving the needle on maternal mortality. But for now, we really look at those leading indicators. Are more women getting care? Are we identifying risks faster? And really importantly, are we making those escalations that those risks are treated by providers appropriately?
Got it. Yeah. And oftentimes the funding mechanism can be a little bit of a barrier in terms of people getting the right kind of care at the right time. And you've adopted value-based payment model quite effectively from what I understand. So just talk to us a little bit about the opportunities and challenges you face given, value-based adoption across the healthcare has been slow. I know I've been talking about it for well over 15 years now, and it seems inconsistent in terms of the adoption. So just talk to us how you've done it and what has been sort of the outcome as a consequence of that.
Okay. So all the services I just described that really are designed to help mitigate complications, extend providers into the home, the system today under fee-for-service isn't funded to support that. And so when we went down this path of scaling our clinical impact by better tethering to OB providers, extending the support to patients, we knew there had to be a funding mechanism to do it. And value-based care really aligns all the stakeholders in the right way. And the challenge we found is the observation you're making is that in the sort of early days of value-based care, at least in commercial and Medicaid, I would argue we're doing better in Medicare, but in commercial and Medicaid, it's not enough just to have a payment model or pay for performance for quality. There has to be tools and capabilities that providers can adopt so that they can actually transform care. And the most important word in value-based care is the care part. The payment model just rewards the changes to practice, rewards and funds some of the things like remote monitoring and things that we need to deliver on this promise. And so, we continue to be very bullish and believe, of course, that the move to value is inevitable, and probably even more so given the plight of the healthcare system coming out of the pandemic, the staffing shortages, the challenges the health systems are facing. We believe the only way to fund this recovery and have sustainable care models is through payment models that reward efficiency, that reward outcomes. So I think it's inevitable. I just think we are lagging as a system of having the right tools and capabilities in place at the point of care to get us over the hump. And so we're finding at Wildflower, and we come with the full package of saying we have the payment model, we have the partner providers, and we have the tools and capabilities they can adopt under the bundle to hit the savings. It makes it so much easier to get going and to really put these models in place. But you really do have to have the full package in order to get the adoption that we need to see.
Indeed, and I'll just make a comment here about that as well. I think one of the reasons value-based probably continues to lag is it does not include the consumer, it does not include the patient. It seems more like an enterprise, a business-to-business transaction, and I think that's probably in just my 2 cents about why it's probably still lagging, because the benefits of it, the intrinsic benefits of it seem very, very intuitive to everyone, or should feel intuitive to everyone. So in any case.
I completely agree. It's not just a financial machination of going to the lowest cost facility. It should be a patient transforming experience. And ideally in commercial plans and employer plans, there should be a cost sharing benefit to it. So you feel it not only in the way you get care, but how it's paid for, and it's more cost effective for you as a consumer. So I know we're going to get there, at least in OB. It's what we're working on, but it's going to take some time.
Indeed. Yep. Still encouraging that you're making progress on that front. So let me pull one other thread, because you sort of alluded to this earlier in describing how you all do work, which is social determinants of health, which in my opinion are critical to improving the triple aim of care. And I think it is more so when it comes to women's health, given their propensity to put their family first. So what is your take in terms of using SDOH, and how do you see it manifesting in the real world? Some examples if you have top of the mind.
So we launched our very first client in 2014, and it was the state of Wyoming Medicaid, as I think you know. And even back then, when we were a 10-person company, we were dealing with social determinants. So we set up the Wyoming first digital front end for state of Wyoming to include things like transportation benefits and things that are really needed, and this is for Medicaid population, and help connect those dots and help rural populations get access to care. So this is something we have been working with even before social determinants of health was a term. And I think now about even going more broadly. It's not just about connecting resources of sort of low-hanging fruit like access to healthy food, or not that those are low-hanging fruit, but it's sort of the current universe is about access to food, access to transportation and care. But we are beginning to think broadly about sort of the determinants of health beyond just socioeconomic factors, which are super important. But what are the other things in your life that may keep you from following a care plan or getting the right care? So we're screening, for example, for the patient activation measure, which is a measure of how confident you are at navigating the system. We are screening for behavioral determinants, right? How do the way that you behave and the way you respond to care plans or lifestyle changes change the way you need to be communicated with. and my team that works with patients just has this vision that you at the point of care, you've got a prescription, you've got a care plan, you have a procedure. But again, that is a very small part of your interaction and your ability to be healthy and ability to inform your well-being. And so we begin to think about what are all the other layers of your life, which could be social determinants. It could be, am I stressed about my job? How do I feel about being a parent, my marriage, my social status, my economic, my race, and really try to bring those together to understand our patients as humans and mitigate on any of those things that may keep me from being healthy. So I think we're just at the beginning of what we've called the social determinants of health as an industry, and we're beginning to really think about all the dynamics in a person's life that will influence how they respond. And of course, at our company, we're adding all of these things as we look to assess sort of risk and health. We include a whole range of socioeconomic and behavioral factors that will inform how we support that patient and what interventions and resources we're connecting with is sort of tactically how it gets done.
Absolutely. You made a comment in there about the fact that, because I think there's a little bit of a bias towards having these avatars where, it's either a patient or a member or whatever, right? At the end of the day, they're humans. And my general sense is social determinants of health kind of brings us back to the fact that we're dealing with humans. It's just not a persona of some sort, which becomes very abstract in so many ways. So I'm glad you guys are looking at that. Let me ask you one other question. At HFS, we've written about this at length over the last couple of months about what we think are going to be the disastrous impacts of the Supreme Court's overturning of Roe versus Wade. We believe that it will have poor financial outcomes, as women may be forced to quit the workforce and schools. Health outcomes will likely get worse due to limitations to access, and the consequences of having to raise an unplanned or support an unplanned family, and the impacts to the health as mental health issues also arise from the trauma of having to be forced into a life-changing event. I'm curious, you're sort of on the front end, on the front lines of maternity care. What are you seeing on the ground?
Yeah, look, we already have a shortage of OB providers, shortage of midwives. We don't have enough providers for the care that we have. And so these providers are already strapped and overwhelmed. And so now we add another stressor, if you will, to their workflow. And, you're hearing stories like there was an article in the Times about a recommendation that Arizona providers have an attorney on the line to decide which patients they can intervene on and which they can't, because it's so unclear, right? The nuance of women's health is not captured in this legislation, these laws that are going into effect. And so you've got providers who, again, are already overwhelmed and now dealing with, potentially criminal consequences of clinical decisions, which is, I fear, going to, drive potentially more OBs to early retirement, make our access to care problems even worse. And not to mention, like you said, just the realities that we will have more unplanned pregnancies. Those will be probably tilted toward women who don't have the resources to travel or do other accommodations. And so the impact on our state Medicaids in the states where these bans are going into effect is going to be really pronounced. And all of the statistics we've been talking about, maternal mortality and complication rates are poised to get worse. So it's definitely a looming crisis. It's still early days to know exactly how all these things are going to manifest. But for a company that operates nationally, we're thinking about getting legal counsel on how do we, what are the different policies and procedures that we can have in place and still be within the law supporting providers in different states. It's definitely a whole new world we're navigating.
Indeed. I think the way you frame it as a stressor couldn't be more accurate, because it appears to me that this is just not this just doesn't just impact women who are looking for medical intervention from a maternity standpoint. It could impact all women, because if OBs in general begin to feel so stressed out that they want to quit their professions, it's going to impact all women everywhere. And to me, that's probably the bigger of the unintended consequence that we will likely experience at some point.
Yeah, and as you pointed out, behavioral health is such a big issue, really across women's health, but particularly in pregnancy. One quick anecdote: we did a program for a provider practice that was aimed at obesity and hypertension. And what ended up happening was the number one reason we escalated to providers was because of high scores on the EPDS, the Edinburgh Depression Survey. So this, like, we already have this sort of underlying epidemic that's often undiagnosed of behavioral health issues during pregnancy and postpartum. And I think we will, that is also poised to really grow as you have, again, women with unplanned pregnancies that maybe they can't afford to have the baby, they don't have the right support to have the baby. It's, again, going to make that crisis worse as well, I believe.
Indeed, indeed. Leah, let me ask you one last question. Let's pivot to something probably a little more encouraging in terms of what the future might bring to bear. The pandemic, I think, has accelerated telehealth and probably ignited digital health opportunities. You're sort of in that space, so share your observations, if you would, about the evolution of digital health and where do you think it's going to go from here in the space of, say, the next decade?
Wow, and next decade, so we've been in this for a decade, right back when it was in the early days of digital health. And I think, we've gone through the hype cycle, right? There was the early hype cycle that digital health was going to solve all these healthcare challenges, and it's proven more difficult than I think a lot of people realized. Maybe some investors realized at the beginning. And the pandemic, of course, was a shot in the arm in terms of adopting a lot of technology really quickly. And what I hope for the sustainability of this industry over the next 10 years is sort of we take the lessons of the past and really apply them in a couple of key ways. One, I think it probably became obvious during the pandemic and continues to be obvious that for the healthcare innovation to really scale and sustain itself, it has to be integrated into the incumbent healthcare providers. We are never going to build enough new concierge clinics or have enough DTC to move the needle on this huge, complicated industry unless we figure out how to work with everyone from nonprofit hospitals to FQHCs to inpatient psychiatric facilities. You got to go everywhere, right? And really understand, and different companies work with different providers, but it has to integrate and support the existing provider ecosystem, or we're not going to have a scaled impact. The second thing that, again, what I'm excited about with value-based care is there's this really great opportunity to integrate health and services from digital health into value-based care models and make those companies, including companies like ours, part of the ROI, part of the saving share, put risk against the value that we can create. Because again, digital health can't just add cost to this system that already costs too much. It has to reduce costs and ultimately prove that. And I think value-based care can help do it in a really compelling way.
Indeed.
So that's why I think those are the two things I'm predicting will make digital health more meaningful in the future.
I have faith that might come true. So, but in the meantime, I appreciate what you and Wildflower are doing. I think it is yeoman's work out there because it is much needed, particularly in the current circumstances and as things evolve into the future. So thank you for your time. Appreciate you spending time here chatting with me about what I think is an important issue of the day.
Thank you for having me.